Hello, Dr. Lance Vernon here. We're going to talk about flossing briefly today. So people who don't floss, this is really aimed kind of more at those people. And so I have here a floss holder. You can get these at the drugstore. These are handy because we don't have to talk about how you hold the floss in your hands, etc. This is kind of like a training wheels on a bike. Okay, it just makes it easier, and if you want to progress towards holding the floss in your hands, that's great. But for people who do not floss regularly or do not floss at all, what's important is to develop a daily habit to do it at night before you go to bed. And what's really critical is doing the technique properly. And so what I tell people is, if you're just doing 6 teeth a day, but you're doing it well, and you're doing another 6 teeth the next day, you're doing it well, that over time you will develop the habit. So it's important to do this daily and to work the technique properly. So let's talk about what is proper flossing technique. Now, the floss will go in between the teeth, and you can't see this, but I'm actually pushing the floss this way. I'm pushing the floss against the side of this tooth. Excuse me a second. Again, we're pushing the floss against the tooth. And so there's a force of the floss against the side of the tooth. You can even hear like a little eek, eek, eek if this is in your mouth. Okay? So if you're pushing the floss against the tooth and sliding the floss down, it'll slip between the tooth and the gum, under the gum line. So from your bottom teeth, under the gum line, and your top teeth, above the gum line, so to speak. Okay? We call it apical in dentistry, but that won't mean a whole lot for most folks. So you're pushing the floss against the tooth on the downstroke and on the upstroke. 1, 2, 3, 4. Okay, now if you push the floss between the teeth and you just go straight down, ow, that hurts. You'll go straight into the gum tissue. That's bad. So you're always pushing the floss against a side of the tooth. Remember, between 2 teeth, there's the one side of this tooth, and there's the other side of this tooth. So I finished this tooth. I'm coming over here. I'm doing the same thing. I'm pushing the floss this way. You can't see that force, but if you were to look from the top, this would look almost like a bow and arrow, how it's bent when you pull the arrow back. And so I am scraping the long surface of the area of the tooth below the gum line on the up and on the downstroke. 1, 2, 3, 4. Okay. Let's look at that up top. Top teeth. Same thing. I'm pushing against the tooth, and as I'm pushing, I'm letting that go up under the gum line. 1, 2, 3, 4. Now a tooth can change. Now, don't try this at home, but here's a tooth. So this is what it looks like, under the gum tissue. You have a tooth like this. So once you get up top here, you don't suddenly, okay, I can push up. You keep pushing against the tooth because it's kind of like a little, bottleneck shape. It's going to come in a little bit here, and you want to still be pushing against the tooth. So you can even have the angle slightly diagonal, so you get up into that area between the tooth and the gum, and you can even do that from the back as well. But generally speaking, you're coming straight up, you're pushing against the side of the tooth, and you're going up under the gum line. 1, 2, 3, 4. I come down below that area of gum tissue. I'm not going straight across and hurting the gum tissue. I'm coming down a little bit. I'm touching the side of that tooth. 1, 2, 3, 4. Go to the next tooth. Whoops. Okay. 1, 2, 3, 4. This tooth. 1, 2, 3, 4. All the way around. Now, in the mirror, when you're doing this, you can see this being done. You may need to pull your lip down so you can actually visualize that being done. And it shouldn't hurt. Again, that's important. Going to the dentist and getting your teeth clean is important. So is doing the home care to maintain that good oral hygiene. So let's talk about, as you go, I try to describe this as like cutting a pizza. You know, you cut a pizza, you're sort of aiming the knife towards the middle of the circle, okay? Now, as your teeth go around, the angle of the teeth meeting is going to change. So you need to change that angle of how you hold the floss holder to adjust to that. And you can see this in the mirror on the front teeth, and it's a little harder with the back teeth. So what you can do is get in there with your other finger and find that area between the two teeth, position your floss in the side, and kind of gently wiggle it through. So let's talk about tight contacts. Some people have very tight contacts. You want to hold the floss very high, excuse me, wiggle it back and forth as you're aiming the floss towards one tooth. So when it does break that contact point, you don't go boom up into the healthy tissue and hurt yourself. You go against the tooth. Okay, so you're holding it tight, small little movements back and forth to break the contact, and then you're doing that up and down motion. So if you could visualize a tree being in front of you, and the tooth is a tree, and at the base of the tree there's moss around it, imagine a big rope, and you're scraping that moss off with that rope. That's kind of what you're doing. If you could think of that moss as being sort of below the gum lines. Okay? Some people do this when they floss, this kind of back and forth thing, and you're only getting the moss off in that one area. You want to get the moss off that total area, so you're doing that motion up and down with the flossing. Now, some people will have difficulty using a floss holder because their teeth, they have had some amount of gum disease perhaps, and so these teeth actually appear to be longer, and what's actually happened is due to gum disease they've lost some gum tissue and bone, and so the teeth appear to look somewhat more like this. Okay, and this poses a difficulty because you can't get that, you're blocking, the teeth can block getting that floss all the way down under the gum line. So what we have here is a floss holder. I have a piece of floss, it's about 12, 14 inches long. I take the small end, I wrap it around, 1, 2, 3. There's some grooves in here. I go through the, groove, other groove. I hold the top, like I squeeze it. I put it through the other groove, 1, 2, 3. This is nice and taut. If I don't do that squeezing bit, it'll be loose. I'll go in there the first time, and the floss will come undone. So with the floss holder, people can get those back teeth. You can feel in between, maybe with your other finger, you feel that area. You do the zip, zip, zip between the teeth, 1, 2, 3, 4. You pull that closer, you hit the back side of the other tooth, 1, 2, 3, 4. Okay, so this is good for posterior teeth. People can't see the posterior teeth in the mirror when they floss. That becomes problematic, and so they skip those teeth. And actually, those are the most important teeth to floss because there's a bigger surface area. The plaque accumulates, it starts to grow under the gum line, causes inflammation with that tissue, and that leads to the initiation of gum disease, which can ultimately result in the loss of tooth structure, or actually the tooth may become mobile, wiggly, and need to be extracted. So what I was talking about though is there are some folks whose teeth are a little bit long here, and so imagine these being out another 1/4 inch, 1/2 inch, okay, just for sake of argument. And so if that were the case, you come in here with this device, this floss holder, and catch that surface without bumping into the teeth as you might with this, where it would get kind of stuck at the top. So some people like this, these kind of floss holders you can get at the drugstore for all their teeth. Definitely for posterior teeth it makes it easier, but some people may need to use it on anterior teeth, or teeth where there is loss of tissue. Okay. Okay, audience question. Let's say you're flossing and you have gunk on the floss. What do you do? Now, if you had your fingers with floss, you might just roll and go down further on the floss itself. But when you're using these, what I would say is wipe it under the water in the sink. So you're right there. You clean it between teeth or once it gets dirty. This reminds me of one very important thing. If you're doing this technique properly, which is getting in between the teeth and flossing below the gum line, if there's bleeding, what that really indicates is that you have plaque below the gum line. It needs to come out, and that tissue is bleeding because there is floss there. Some people think, oh, it's bleeding, I shouldn't floss there. That's not true. So as long as you're doing the technique properly, over about this period of a week or two, you should have less and less bleeding. But let's say there is bleeding, you can floss that particular tooth, run the floss holder under the water, go to the next location.